Hi, welcome to Cancer Tamer. I'm Dr. Charlie Ferrer, host and founder of cancertamer.org. Today, I have my best friend here, Deborah, with me, who is going to talk with us about what happens when we go through cancer. And we thought we'd take a little time out and back up a little bit and talk to you about what happens when you're diagnosed and also even before diagnosis. So, as you know, this show is all about talking about the different ways of handling cancer, dealing with cancer, what goes on in your life, also about talking to your doctors, what doctors you would go to. So every week we'll be bringing you a little more information about what's going on and about different things you can do. I am a clinical sexologist and sex therapist, so my focus is more on relationships and sexuality. And I'm also a cancer patient. I have breast cancer and I've been tested for other things. So we'll be talking about those too. So I like to make it and keep it as real as possible. I also invite you to come to our website, which is cancertamer.org, and be able to ask questions there, be able to send your information, and we'll have a little more information about the things that we'd like for you to share with us as well. But we'll also have physicians, clinicians, and we'll be talking about all the different kinds of treatment that are out there, not just radiation and chemo, because that's not all that's out there. As you know, you may know her from our last segment. She has a segment on this show, Deborah Santulli Barone, who does the Did You Know segment for Cancer Tamer. So thanks for being here with me today.
Thank you for having me back here. I enjoy the show so much and I enjoy working with you. It's been great. And I think it's very important that people tune in because there's so much information that you should know about. I'm cancer-free 2 years from breast cancer and working to keep it that way for the rest of my life.
And she also helps me out when I go crazy, and she tells me all the different things that I can know about. Because the one thing that you'll find out about this journey is the fact that there are so many things that happen and so many things that you go through, and you can't remember them all, and you can't think about them all. So it's wonderful to connect with other women who may also be going through the journey or have already done it and are cancer-free and are in recovery. One things that I want you to know so many things, but one of them is that all the opinions that you hear on this show are our own. These are my opinions, these are Deborah's opinions, and they're the opinions of the guests that we have on our show. Your opinion might vary, and these opinions are not the opinions of the station that we're with. So we have to do the little disclaimer to keep everybody happy. So, you talked before about mammographies and stuff, but I wanted to also talk about breast exams and self-breast exams, which are so important.
Yes.
And why they're so important.
Well, that's very difficult because someone like me who has a lot of lumps and bumps, I can't tell the difference. So, but to practice every month would be helpful. And let your doctor teach you if you really don't know how to do it. And if worse comes to worse and you think that you feel a lump, you should go to the doctor right away. That's a very important factor.
And I'm going to do a little demo here, okay? So the one thing to remember, for me, I actually found my own breast cancer. Because I was doing and I have to say I don't do them every week, and I don't, before I didn't do it every week. If it was, once a year I thought about it, I would do it. But basically, get comfortable with your own body and touch your body. I mean, it's yours, right? So touch your body. And you can do it laying down, you can do it in the shower, you can, get your partner and your lover to do it for you. Let them touch you and start noticing the different things. And so they typically say, put your hand behind your head. Mm-hmm. So this way you're also looking at these lymph nodes because you have lymph nodes here. So just if you can see, just touch and not just like brush over it, but palpitate it, touch and see, wow, is there a difference there? Is there something there? And then come all around your breast. I'm touching myself on TV, come all around your breast and notice what's there. Does it feel different? Does it, does it move? Is there a lump? Is there not a lump? Does it indent and stay indented? If you squeeze your nipple, is there liquid coming out? Is there not? So these are things that you need to know, because these are signs. They may be signs of something happening. And so talk to your doctor. For me personally, I ended up finding my own when I was just doing my own breast exam, and I was like, oh wow, I haven't done one in a while, and I started feeling it, and I actually had quite a huge lump on my right breast. And so that's how I found mine. And then in December I found it, and I actually wasn't diagnosed, which is cute. I wasn't diagnosed until February 9th when my doctor got to see me. And then they sent me for a breast exam on February 1st, and they did mammographies. And you talked about mammographies
Yes.
before and why they were so important.
Yes, I think it's very important because you need to go every year, because every year your body changes, and especially as you get a little bit older. And mammographies, there's two. There's the regular kind, and there's the 3D imaging, which is sometimes they look at both, the regular mammography and the digital, and compare. The digital shows more. If that doesn't, a sonogram is always good, and an MRI, whatever your doctor prefers, but always advocate and fight for the things that you think is important.
Always advocate.
Yes,
And that's the one thing
definitely.
that we've always been
Oh,
talking with
yes.
each other about. The fact that if you're not advocating for yourself, then no one else is. And your doctor can't do it. I mean, when we stop and think about it, your doctors can only give you this much information out of this much information, and sometimes they don't give you the information. So you have to be your own advocate. And you have sonograms, you have mammograms, and we talked before about the fact that there's organizations that do free mammograms.
Yes, there is actually in Staten Island, and I think also in other boroughs, there's a wagon that goes around for free, and they do mammography certain times of the year. And if they see something, then they suggest you talk to your doctor. But it's a great opportunity to go, because if you don't have insurance, this is one way you can go and get checked, because it's better to get checked no matter where you go than not go at all. People that put it off, when they do find cancer, it's usually later stage. And if you have dense breast, it's important because that's a factor that can increase your risk for breast cancer.
Right.
So that's very important.
And most people, or most women, because I know I was one of them, will think, well, oh, I had a I had a mammogram years ago, and I don't need another one because nothing was found. And so just to give you a little snippet on that, I actually had a mammogram in 2012. And it wasn't until 2016 that when I had my next mammogram 4 years later, I actually had my cancer was the size of a golf ball.
Right.
So, some cancers take a while to grow, and they can't be seen just from a regular mammogram, so you'll need more testing, either a sonogram or MRI or things like that. And if you have, and we were going to talk about genetic
Yes, genetic
testing.
counseling and testing,
And
definitely.
so the good thing is that if you do get one of those, then they test you even more often, which is really important.
Yeah, and it is very important. And also, I had my mammography 2013 in December, and by February, March of 2014, there was the cancer. If they had done a sonogram, they would have found it sooner. I had to fight for that and dump my doctor and go to a new doctor.
I like when she says that.
I just love it. I love dumping doctors. You're not good, you're out the door. That's it.
Exactly. And I made the joke the other day about doctors are like shoes, and not being disrespectful, but doctors are like shoes, because those great shoes that fit you. And so those are the ones that you get, and you can change your shoes based on what you need. So you might have a doctor, you might have a primary doctor, well, that's not an oncologist, and that's not a breast doctor, and so on. So you need to change. And sometimes it's also personalities.
Right.
You might get along better with a male doctor than you do a female doctor, or vice versa. Or you might get along with someone that's your own ethnicity and you feel more comfortable. So it is getting the right pair of shoes for all occasions, the right doctor for your occasion. And so you can, as Debbie says, dump your doctor. And
It's
be
such a
able,
good feeling.
if you don't like them, do change. But I wanted to go back and talk a little bit about the genetics testing and why genetics testing is important and why it actually can help you when you get a genetic test.
Right.
And so what is a genetic test?
Okay, so the genetic test tests the genes in your body to see if you are susceptible to certain cancers. So let's take the BRCA1 and BRCA2 test. That's BRCA 1 and 2. They test that when you've been diagnosed with cancer, but you can get that testing ahead of time, depending on what doctor will order it, because you need to know also your background, your family history. That's very important. My grandmother had breast cancer. My father had colon cancer. Is that a difference? Yeah, there is a difference about that, yes, but it's cancer in the family, so getting tested is important.
And so getting the genetics testing,
Yes.
and the genetics testing lets you know if there's anything wrong with just 24 of the genes in your DNA. It doesn't test all of it. It just tests up to 24 that are known for cancer factors or known as cancer genes. And the one thing that I tell people, because some people will say, oh, well, I have the gene, that means I'm going to get it, so I have to rush and get my breasts removed or get my ovaries removed and so on. And the understanding of that, just because you have this test, that doesn't mean that you're going to have cancer. If your tests come out positive, doesn't mean that you're going to have cancer. Right. It just means that you're susceptible to it. And so you have to be more conscientious.
Definitely.
The great thing about getting a genetics test that I've found is that once you get it, if you are shown to have these modifiers or these mutations in your genes, then you need to be tested more often, more regularly. So, for instance, I have a mutation in one of my genes, my CHEK2 gene, which means that I'm susceptible to about 4 different kinds of cancers. And so that means that my doctors have to test me every 6 months as opposed to every year or every 2 years.
Right.
Which then, from an insurance perspective, means that my insurance will then have to cover that. Whereas sometimes you'll hear the doctor say, oh, well, your insurance won't cover that. And so knowing that if you get this, that's the wonderful thing about the genetic test. But making sure that the one thing with your doctor's talking about, well, your insurance won't cover. Don't listen to your doctor about your insurance.
No way.
Talk to your insurance company, because I've gone back to my insurance company and said, will you cover this? Will you cover this? And my insurance company says yes. Well, my doctor is saying no. It's just that somebody else's insurance might not have covered it.
Right,
so
that's
understanding your insurance company is your insurance company, your doctor is your doctor. Each one has their own function. And so those are the things that we need to look at.
Definitely. Also, with the gene tests for the breast cancer, I was under the impression that if you have breast cancer, then you have the gene. Well, I found out my gene test was negative, but I still had breast cancer. So that's something that you should know, because we're really not educated in that. Our doctors don't teach us this. Nobody ever tells you half of the things that we've been learning in the last year of our journey over here. But it's good. And also to know that dense breasts could increase your risk of breast cancer. And it's important to fight for sonogram, MRI, or 3D imaging is very important with that.
And understanding there are so many things that are connected to this disease. There's so many issues, emotional, physical, psychological, that will come into play. And not every doctor can touch on each one. So being your own advocate, and you're going to hear me say that all the time. You're going to hear Deborah say it all the time. Be your own advocate and talk to your doctors. Talk to a friend. If you feel like, and I've had somebody tell me, oh, well, I'm too shy and I don't stand up for myself or whatever. Well, get somebody that you know to stand up for yourself, or even better, pretend to be somebody else. Pretend to, pretend to be the most fabulous person, kick-ass person that you can be, and be that person. And then
sense.
Go in as that person to your doctor and dress the type so that you can be more comfortable. And even if you're not comfortable today, maybe tomorrow or the next appointment and the next appointment, just like when you talk to your kids about things that are difficult, it's always getting more comfortable on talking about it because you're doing it. Also, we talked about recordings. I'm a big person.
She records everyone.
I record everything. I record every time I go to my doctor's office. I will put them on recording, and I let them know that I'm recording them. But my whole thing on recording is, you get afraid, you get scared after a while of what's being told to you.
Well, you can't even remember everything you're being told. That's the problem.
You can't remember everything. And so being able to record allows you to be able to then turn around and have it for later and listen to it afterwards.
Right.
And also if your partner isn't there because they might be in the military and they're away, or they're away on business, or they weren't able to make it because of work, then you can play that visit back to them and say, hey, this is what happened, this is what's going on.
That's
and I think that's what's so important, and finding a doctor that will allow you to do that, because not all
that's true.
Not all do.
My idea is I go in with an entourage of people. So I always bring my sons with me. One was a biomed student, so he understood a lot of the technical words that I might not have understood. I brought my mother, who was a nurse, and I brought my husband. I actually brought my son's girlfriend too, because she was a biomed student, and they took notes.
You brought the whole
I did. You walk into the doctor's office and he's like, oh my God. I'm like, I'm sorry, but they have to be here. And you know what? No one can tell you that they can't be there, and you have to know that. That's what we talked about. You put on a different persona. You can't beat cancer unless you kick ass, and that's what it's all about. And if you have to wear a kick-ass outfit to go into the doctor's office, you do what you have to do. But it's important. And when I went to the breast surgeon, and then if you have to go to a plastic surgeon, I bring everyone with me. And when you get to the part where you're the oncologist, because you can't think. After a while, you're so inundated and so overwhelmed.
And there's so much information.
Yes.
And the piece of it, too, is that after a while, your brain just shuts down. Even if you're trying to take notes, even if you're trying to do all these wonderful things, your brain shuts down because, one, you're afraid, and two, there's so much to know. So I'm a big advocate on doing that. Also, understanding that some of your family members may not want to go with you, and they don't want to be involved. I know for my son, and bless his heart, he's 29 years old, and he says, Mom, I just can't think of you not being in my life, and so I don't want to talk about cancer. So his thing, and I mean, I get all choked up, but his thing is, if he doesn't talk about it, it's not happening. And I'm going, okay, honey, but it's still happening.
It's real.
So what was cute was he called me this past weekend, and he says, I don't want you to, I don't want you to think I don't want to talk to you. And I said, oh, I thought you were just afraid and pulling away.
And that's what happens.
And he goes, oh no, you're going to be here at least another 40 years to yell at me and tell me what I need to do and set me straight. And I was like, oh, okay, cool.
That's a good
I'll be there. And I'm like, every time you say, Mom, I already know, I'll say, oh, shut up. You told me to.
But it's true. Certain members of your family will handle it differently. Some back away. I know with my experience, mainly with friends, not family, I had 2 friends that just stopped calling me. And it was really depressing at first, because you want to be able to talk to friends too besides your own family. And they can't handle it. And I haven't heard from them in 2 years.
Yeah.
And at this point, they're not friends. The friends I have, I love.
and they're all different. And everyone is different. Because I have 2 sisters. One of them loves to see my scars. So I have scars and stitches everywhere. And she works with things like that. So she's comfortable. The other one is like, no, don't show me. Don't show me. I don't want to look.
I know. My sister doesn't want to look either.
So she's very squeamish. So I have both ends of the spectrum, which is funny. And so my big joke now is that I'm a cancer tamer stripper. I'm a cancer tamer stripper because now everywhere I go, I have to, not everywhere I go, but when I go to all the doctors, I have to take off my clothes and I have to show everyone my breasts and I have to, and they have to see the scars and they have to see how I'm healing and so on because I still have all my stitches. But I started joking, and now I'm just going to call myself the cancer tamer stripper because I'm just like taking off my clothes and showing everybody everything. And so, so the point here is that sometimes your family members or your loved ones or your friends may be more interested in what's happening with you and others won't be. Right. And it's okay. There's no right or wrong on that. It's okay for them to feel comfortable and you can't push it. You can't push it on them because then that's being disrespectful to your family members, to your loved ones, and that's not right.
No, I understand that part. I think though it took a while for me to get over it because it did hurt. I felt very alone and I felt, and I'm sure other people have been through this, where you feel like, all right, you have a disease, and everyone backs away because they don't want to get the disease. You go through
you're
all
not
of
contagious.
And I'm not contagious. People have to know that.
Cancer is not contagious.
But come on here, let's go like that.
Give you a little bit of mine.
But I'm known for whipping my blouse up and showing my cousins or my friends, oh, you want to see my scars?
Yeah, you want to see my scars.
And they're like, okay.
Yeah, and I think it is funny because I deal with sexuality, so in different events that I go to, there might be different stages of dress, and so what I'm finding is that when I'm going through my treatment or I see other cancer patients, we kind of turn around, especially breast cancer patients, and it goes, oh, well, what are your scars like? Or how do you do it? And I had one lady recently goes, oh, yeah, well, let me show you. And she just pulled up her blouse, and I was like, okay, I was not expecting that. But she was showing me how, and her scars, she had to have additional tissue put on, and so she had tissue put on, and then she did this beautiful tattoo for herself, and so she was trying to show me the tattoo, and of course she had to show me the rest of herself, and I thought it was just very pretty. And so however you deal with your showing your breasts and how you feel comfortable with them, I think is very important, and doing it for what makes you feel comfortable. And
That's true. But getting back to your diagnosis, when you go to your doctor and you bring your entourage or you bring your recorder and you get all this information, the next step, I feel, is to get a second opinion. In my case, I did 3 opinions.
Get as many opinions as you want.
And each person I went to I brought my entourage. And you have to bring your radiology report. You have to bring your pathology report so that they can check it out. The doctors, they need to get it ahead of time so they can look at it so that when they finally meet you, that they know what they're talking about. And you have to get approval usually by your insurance company. So make sure you do that because you don't want to get stuck with a high bill. And
and the beautiful thing is I'm actually creating a book called Cancer Tamer Journal, and from diagnosis to surgery.
Great.
And the beautiful thing about it is that if you create your own book, and from that I mean keep a copy of all your notes, keep a copy of your
test
biopsy,
results.
your test results, whatever test and whatever is going on with you, keep a copy of that, and then keep it in a notebook journal. So in your loose leaf binder and make holes in it and stuff. Mine is about this thick right now from all the tests, but it's a wonderful thing to have your own copies, because if you change doctors, then you can immediately do it. Because I remember when I went for my second surgery, they're like, oh, well, we have to do all this pre-test on you, and we have to take all these blood tests and everything again. And I was like, oh, well, they did that last week. Hold on a second. And I'm going through my paperwork, and I'm like, well, is this okay? Is this okay? And so we went through the whole process over the phone.
No, that makes sense. And to also make sure that your primary doctor has this information.
Exactly.
It's always good for them to have that. Your gynecologist.
All of them.
Besides all of them.
All of
yes.
them having it, and especially you, and having your own notebook. So I'm creating a little book to put it all together, and with a whole bunch of different information on the things that you should know.
Right.
Another piece I'm going to let you know is one of the resources that are out there is that ACS, which is the American Cancer Society, also provides you with a planner, a medical planner that you can use as your own notebook for what's going on. And how to be able to put that together, because you want all your information in one place. And so I did my little dividers. So I have information from my gynecologist, from my throat doctor, from my colon doctor. I just spread everything up, and I have blood tests in there. So it's keeping yourself advised, and that's also, I think, a wonderful way of feeling like you have some control.
Yes.
Because the piece that I see in this, especially with this diagnosis, you don't feel like you have control of anything because people rush you through.
Right.
And it's
you're
like
walking in a fog.
Yes, and you're walking in a fog, and you're walking like you got the gallows on,
Yes.
you know. So I started telling people, yeah, I know what it's like to go, you know, be Marie Antoinette and get your head chopped off, because I'm doing the little walk from one doctor to another, or one test to another, and so. You know, and so doing that and taking the information with you and having it and finding ways of being able to make things fun. And we have like 3 minutes before we end, and we have so much information to give, but we don't have all that time. So you have to make sure that you come back and be with us again, because we're going to have a weekly show and giving you as much information as possible and finding ways. One of the things that I told Deborah, and Deborah shares with me, is that we find ways of making life fun and making life pleasurable, and little tidbits that'll make us smile.
Right, because you have to smile. There's nothing else you could do. For people like us that used to feel like we were in control, and then we weren't for a while, we've taken back control. And that's what you have to do.
And you take control in any way you can. So my thing lately has been that I find all these different little signs.
I love it.
And this was the one that I found. Actually, I had some friends come in from Texas, and we went to Little Italy, and I found this sign in Little Italy. And so I'll let you see this. If you can zoom in.
Yeah, zoom in. Okay,
and
well, you can read it, I guess.
It says, the boobs are real, the smile is fake. So you can, I don't know which way. So you can see, the boobs are real, the smile is fake. So I found this, and I just thought it was the funniest thing under the sun.
I love it.
And so we have another one here.
Yes, look at this. Now we have this. This is the cancertamer.org. Body love, because you shouldn't be at war with your body. Isn't that nice?
And so if you can
see let her explain it all.
Yeah. Well, I ended up taking doing this little sign because I think we shouldn't be at war with our bodies, and that's the premise behind Cancer Tamer. And so if you can see it, you can see the girl is at the hospital in front of the heart, and for me, it looked like breasts, and you have your bra, and your breasts are all bandaged up. And you have the little IV feeding the love. And so we came up with that for Cancer Tamer, and being able to do that on our body love. But if you have any signs or any quotes or anything that you would like to share, please do so and share with us what you find. And email us at info@cancertamer.org. Also, if you would, one of the things that I'd like to do is feature a cancer tamer, an individual who has gone through treatment or is currently going through treatment and would like to give a little inspiration to others. By all means, please contact us. And if you're not in New York City, you can send us a video on MPEG, so it has to be Movie Way, and send us a little video of your own. Thank you for being with us.
Thank you very much. It was great being here with you. Thank you.